lady over here suggests 20 questions. I suggest one. Yes, sir. Your name and where you're from.
Thank you for taking my question.
Certainly.
My name is Bill Tharr. I'm from Summit, New Jersey.
Yes, sir.
And I'm a retired physician.
Physician, medical doctor.
Yes.
Doctor.
And so my question is about healthcare.
Yes.
How many of you here are over 65? Thank you. You are all part of a single-payer healthcare system. It's called Medicare. Medicare happens to be twice as big as Canada's entire system. It's about the same size as the English National Health Service. It's a little smaller than France's healthcare system and a little smaller than Germany. We actually know how to do this.
Yeah.
Now, it's really embarrassing to see Congress stumbling around trying to figure out what to do with healthcare. When we already know. We've done this for over 50 years. It's one of the most successful programs in the United States. It operates more efficiently than any private health insurance company. Its overhead costs are about 2%. It represents universal coverage for everyone over 65. And when I turned 65, I was not only relieved, I wondered why everyone else didn't have this. Now, I've never figured out why we haven't made Medicare universal and improved it. I wonder why my granddaughter can't have access to this wonderful healthcare system. I wonder why we have to create different systems for different parts of our population. Why we have to relegate the poor to one system, the veterans to another system, the elderly to another system, and the employee to a private health insurance system. There have been over 20 studies that show that universal health care using Medicare would save us money, insure everyone in the country, raise benefits, all at the same time of not costing us a penny more than we're spending right now. So it makes absolutely no sense. So my question is, would you support universal health care using a model based on Medicare and improving that model as we move ahead?
About 170 million Americans receive their health care coverage through employment. This does not mean that they necessarily are personally employed. It could be a spouse, and it includes, of course, minor children. 170 million Americans. About 50 million Americans or so receive their health benefits through Medicare, as you have explained. And about 70 million Americans receive health care coverage through Medicaid. And if we were to reinvent the wheel, perhaps we would move in the direction you have suggested. When President Obama was first in office and the Democratic Party controlled both houses of the federal Congress, there were...
Lower the age to 0.
There was not enough support for the single-payer system.
There will be.
So, I do not favor a single-payer system. I favor building on the system we have.
Why? Why?
part of the system we have, it, works very well. The interesting thing is since World War II, we've had sort of an international experiment. That is, all the wealthy democratic countries in the world, except one, that's ours, decided to implement their form of universal health care with strong government intervention. At the end of this experiment, we end up with a healthcare system that costs twice as much and provides care that's on average sort of in the middle of all those other countries. It seems our experiment has really failed. The one system that seems to resemble what has been successful in other countries is Medicare. It's a system that's already implemented, that has large participation of physicians across the country, could be implemented very easily because the administrative structure is already there, and then we could work together to improve it. So why can't we move ahead on that?
Do you favor requirement of physicians to participate?
I would favor a requirement for physicians to participate, yes.
Do you agree with me that that would be very difficult to achieve and that it would be opposed by the American Medical Association?
Actually not. Physicians, a majority of physicians actually approve of single-payer healthcare. And we've seen a movement, especially in the last year, toward single-payer healthcare and several articles that actually support the implementation of single-payer healthcare.
I do not think it's likely, and I certainly would be willing to analyze any facts to the contrary. I do not think that that would be supported by the AMA. I think the AMA...
Well, the AMA represents about 15 to 20% of physicians. It's actually a very small part of
other communities. Other physicians are represented by their
specialty groups. So groups like the American Academy of Family Physicians, the American Academy of Pediatrics, and several other groups have supported single-payer health care. I'm a part of a physician group called Physicians for a National Health Program, which has over 15,000 members who also support single-payer.
I'd be happy to review any literature you can send to my office.
I'd like to sit down and talk to you about that.
Absolutely, Doctor. I do.
It's also one of the best ways to redistribute wealth in the country by providing a broad base of healthcare support for the entire population.
I certainly want to improve the healthcare situation in this country. I think that we spend too much percentage of GDP on it. I'm not convinced we should go to a single-payer system, but I'll be happy to sit down with you, Doctor, and I commend you for your question.
I wish you all the success.